In the ruins of a once bustling Caracas hospital where silence now echoes through empty halls and hope seems to have faded, a story quietly unfolded. Amidst the crumbling walls, a single statement echoed with haunting clarity: "Filipino nurses saved my hospital." These weren't the words of a politician or a distant observer, but of Dr. Alejandro Ramirez, a surgeon who witnessed firsthand the collapse of Venezuela's healthcare system and the despair that followed. His confession wasn't about foreign aid or political agendas. It was about the resilience and spirit of people who refused to give up, even when everything else seemed lost. In Venezuela's darkest hour, when the world seemed to turn away, a handful of nurses from the Philippines brought light and hope where there was none, stepping into chaos with open hearts. Their courage, compassion, and unwavering dedication became the most powerful medicine in a nation starved of hope, offering comfort and healing to those who needed it most. Dr. Ramirez's words honored those who arrived when so many had left, recognizing the quiet strength it took to stay and serve. These nurses reminded us that humanity can rebuild what's broken, one patient, one act of kindness, one moment of compassion at a time. The world saw Venezuela's chaos, the headlines filled with crisis and despair, but missed the quiet revolution happening in hospital corridors, where hope was being restored, patient by patient. These nurses weren't seeking glory, recognition, or wealth. They answered a calling, driven by a sense of duty and compassion that transcended borders. Their story isn't a mere footnote in history, it's the very heart of the crisis, a testament to the power of empathy and the difference a few dedicated souls can make. Dr. Ramirez's revelation asks us to look closer, to see beyond statistics and headlines, and to recognize the human stories that often go untold. It invites us into a hospital where the stakes were life and death every single day, and where the smallest gestures could mean everything. This is more than a report from a failing state. It's a lesson in resilience, in hope, and in the extraordinary power of a few dedicated souls to change the course of countless lives. Sometimes, the greatest heroism is simply the choice to care, to show up, and to keep believing in the possibility of healing, even when the world seems broken. Dr. Alejandro Ramirez was the soul of Hospital Vargas de Caracas, a figure whose presence inspired both awe and comfort among staff and patients alike. For decades, he was a symbol of Venezuelan medical excellence, a mentor to generations of doctors and a beacon of hope for the community. He remembered when the hospital thrived, full of resources, hope, and young doctors eager to learn, their eyes bright with ambition and possibility. But as the country declined, he watched his beloved hospital stripped of staff, supplies, and dignity, the once busy wards now eerily silent. While many colleagues fled to safer, more stable lives abroad, Dr. Ramirez stayed, refusing to abandon his patients, even as the world around him crumbled. Each day became a test: how to operate without electricity, treat infections without antibiotics, and make impossible choices with limited tools. He faced grieving families with nothing to offer but compassion, his heart heavy with the knowledge that sometimes kindness was all he had left. He improvised, rationed, and carried the weight of the hospital on his shoulders, often working late into the night to keep hope alive. The emotional toll was immense. Hope was fading, and the burden of responsibility grew heavier with each passing day. He believed in order and science, but chaos reigned, and the systems he trusted seemed to unravel before his eyes. Victories were rare, and problems multiplied, each new crisis threatening to overwhelm what little remained of the hospital's spirit. Dr. Ramirez was a captain on a sinking ship, surrounded by a dwindling crew, yet determined to steer them through the storm. He had skill and will, but hope was slipping away. He felt utterly alone, haunted by memories of better days and uncertain of the future. Yet, he stayed, anchored by duty, driven by a promise to his patients and to himself that he would not give up. He didn't know help was on the way, but in his heart, he clung to the faintest glimmer of hope that change was still possible. Venezuela's healthcare collapse was slow and relentless. Once a model for Latin America, the system crumbled under economic mismanagement and political chaos. Hospitals fell silent, pharmacies emptied. Over 20,000 doctors fled, leaving a gaping wound. Those who remained faced a nightmare: no water, no electricity, no supplies. Patients brought their own food, water, and medicine if they could find any. Surgeries were canceled because the lights might go out. Hospitals became places of infection and despair. Chronic illnesses became death sentences. Preventable diseases returned. Dr. Ramirez saw it all. Patients dying for lack of basics, staff burned out and hopeless. The system wasn't just broken, it was gone. Into this void a new light was about to shine. Into this desolation walked a group of Filipino nurses. Their arrival was a mystery. Why come to a collapsing system? They weren't part of a big NGO, but a small, faith-based initiative. For them, nursing was a calling, a mission to serve where needed most. They'd seen hardship in their own country and brought resilience and community. At first, local staff were skeptical. The nurses were outsiders, unfamiliar with the chaos and language. But they didn't try to change everything. They simply began to work. They learned Spanish, observed, listened, and cared for patients with rare tenderness. Their determination was quiet but steady. They showed up, uniforms clean, never complaining about shortages. Instead, they found ways to work around every problem. Their energy was unwavering. Dr. Ramirez watched, expecting them to falter. But they didn't. They just worked. Change came not from new supplies, but from small acts of kindness. Maria, a Filipino nurse, sat with lonely patients, combing hair and offering comfort. Rico shared his own bread with hungry children. These weren't hospital protocols, they were pure humanity. The nurses gathered to pray before shifts, drawing strength from faith and each other. Their unity was contagious, breaking down barriers with local staff. They pooled resources, shared meals, and included Venezuelan colleagues. The hospital began to feel like a family again. Small acts planted seeds of hope. Patients smiled, staff found renewed purpose. The Filipino nurses treated not just disease, but despair. Blackouts were common in the city, but on this particular night, the hospital was plunged into a darkness deeper than anyone had ever experienced before. The familiar hum of machines faded, and the corridors became shadowy and silent. The backup generator, usually a reliable lifeline, failed unexpectedly. Monitors, ventilators, and lights all went dead. The hospital's heart seemed to stop as machines went silent, leaving only the anxious breaths of patients and staff. Panic swept through the wards. Nurses and doctors exchanged worried glances, and patients' families clung to hope. But in the midst of confusion, the Filipino nurses acted without hesitation. They didn't wait for orders or instructions from anyone. Instinct and training took over. Using the glow of their cell phone flashlights, they moved from bed to bed, checking on the most critical patients first, making sure no one was left unattended in the darkness. One nurse rushed to the neonatal unit where tiny lives depended on machines. Another sprinted to the ICU, manually ventilating patients whose lives hung in the balance. Their hands became the machines, their determination the power source. Their movements were swift, coordinated, and purposeful, as if they had rehearsed for this moment all their lives. Dr. Ramirez, awakened by the sudden silence, saw the nurses in action, a team moving with calm precision. They comforted frightened patients, assessed emergencies, and kept the atmosphere as calm as possible. They relayed vital information to Dr. Ramirez, ensuring he knew which patients needed immediate attention and which could wait. For hours, these nurses became the hospital's heart and hands. They fanned overheated patients, held trembling hands, and never faltered, even as exhaustion set in. Their presence was a comfort in the darkness. There was no fear in their eyes, only unwavering focus and deep compassion for those in their care. As dawn finally broke, the nurses were exhausted, their faces drawn with fatigue, but their spirits remained undaunted. They had given everything they had. Through the long night, they had kept death at bay with their courage, their skill, and the small but powerful light from their phones. The hospital survived the night because of their relentless dedication and teamwork. Their bravery was a beacon in the darkest hour. They didn't stop to rest, didn't complain, they simply did what needed to be done, supporting each other every step of the way. Even as fatigue threatened to overwhelm them, they pressed on, driven by a sense of duty and love for their patients. The staff and patients saw what true dedication looked like that night. Gratitude filled the halls as the sun rose, and everyone knew they had witnessed something extraordinary. In that darkness, hope was reborn. The nurses' actions became a symbol of resilience and compassion for all. The Filipino nurses became the hospital's lifeline. Their courage, unity, and selflessness changed everything for those who depended on them. They proved that even in chaos, compassion leads the way, and that true heroes shine brightest when the world goes dark. As the sun rose, Dr. Ramirez stood in the ICU, watching the Filipino nurses prepare for another day. The hospital was battered, but not defeated. He realized the hospital wasn't saved by money or machines, but by the nurses' compassion and spirit. Later, a journalist asked how the hospital survived. Dr. Ramirez looked at the nurses sharing lunch with a patient's mother. "Power didn't save us. "Money didn't save us. Filipino nurses saved my hospital," he said. That was his epiphany. The true heart of healthcare is human connection. The Filipino nurses brought more than skills, they healed the hospital's soul. They reminded everyone what it means to care. Their kindness and resilience became the hospital's cure. They restored hope to a weary surgeon and a broken institution. The hospital's survival was a testament to their dedication. Healing, he realized, begins with the choice to care. The legacy of the Filipino nurses isn't in reports or monuments. It lives in the memories of patients, inspired colleagues, and a doctor whose hope was restored. Their impact was measured in small victories over despair. They proved that kindness can be revolutionary. These quiet heroes didn't seek recognition but earned a nation's gratitude. Their story transcends borders, a universal truth about heroism. Filipino nurses embody a global spirit of service, known for their gentle, skilled care worldwide. Hospital Vargas didn't magically recover, but something fundamental changed. There was new solidarity, a belief they could face challenges together. The nurses reignited a culture of care, teaching new ways to cope, emotionally and spiritually. They showed that in darkness, community and service are powerful. The most essential infrastructure is human compassion. Their quiet courage left an indelible mark on Venezuela's soul. The story of Dr. Ramirez and the Filipino nurses is a testament to the spirit of service and kindness that defines Filipino nurses worldwide. They are the backbone of healthcare systems, caring for our loved ones in their most vulnerable moments. Now it's your turn to share. Have you been touched by a Filipino nurse's care? Share your story in the comments. Use #Filipino nurses save lives to join a global chorus of gratitude. Let's honor their sacrifices and celebrate their contributions. Your story could inspire others or remind a tired nurse that their work matters. This is more than a call to action, it's a global thank you. Let's ensure their legacy is never forgotten. Celebrate, thank, and lift up these quiet heroes who change the world every day.